The Obama Medicaid expansion under the Affordable Care Act, ACA, was established to reduce the number of uninsured Americans by expanding eligibility to cover more low-income individuals. Before the ACA Medicaid, the medical aid was limited to a specific low-income group like the pregnant women, the elderly, the children, the disabled people, and a few other groups. The Medicaid expansion program under Obama was not adopted by all states, which led to a coverage disparity in the US. The data source used for this analysis was compiled from the United States Department of Health and Human Services and the United States Census Bureau. And this data was sourced and provided by Quantum Analytics. The data set has been cleaned and all the inconsistencies like duplicate values, null values, missing values, the errors, all the inconsistencies have been removed before importing into Tableau. So the tool for our visualization tool is Tableau. And this are our KPIs, the number of states. We have 51 states. The US was added to know the total number of the total population of the citizens that benefited. The state's Medicaid expansion. The state's Medicaid expansion program, as I've explained earlier, was not adopted by all states. So the states that did not adopt the program are 19. The state's Medicaid expansion through the 32 states were those states that adopted the program. And we have total employer health insurance coverage. So before Obama Medicaid expansion, most Americans get their medical insurance from their employers. However, not all jobs were covered, especially the part-time or low-wage jobs. So what the ACA did was that they imposed the employer mandate that businesses with 50 or more employees should offer affordable health insurance or face a penalty, while the Medicaid expansion targeted the low-income individuals. So these are the total coverage or total employees that were covered between the period of 2010 and 2016. And we have the last KPI, the total marketplace health insurance coverage. So the total marketplace health insurance coverage is a kind of insurance that was used by the government to provide a plan for those people who cannot or were not covered by employers' health insurance, and at the same time, they were not covered by Medicaid expansion program. So these people, the ACA provided a sort of insurance plan for them that can be purchased by a private individual, and the plans were standardized to provide essential benefits and also protect individuals against discrimination. The targeted population were those who did not qualify for the Medicaid or employer-based coverage, like as I said earlier, and it offers the self-employed, part-time workers or others without job-based insurance and opportunities to be able to buy their own private insurance plan. Our top visualization, top 10 uninsured states in 2015. So the purpose of this analysis or the objective is to visualize how the Medicaid expansion program reduced the number of uninsured citizens, and we want to be able to discover the rate at which citizens without insurance were covered. So here we have the top 10 uninsured states in 2015. Alaska is the highest uninsured state in 2015. It has a percentage of 15% uninsured population, followed by Florida, Arizona, and others. Then the Medicare enrollment by states. So this first one is for the whole of United States. This first state that adopted the Medicaid program with the highest population of enrollments is California. Then we have Florida, then Texas, and others. Then top 20 states uninsured rate change. So this is the difference between the uninsured rate in 2010 and 2015. And we can find out from here that in Louisiana we have the uninsured rate change to be approximately 6%. That means that the uninsured rate in Louisiana from the period of 2010 to 2016 has reduced with a percentage of 6%. In Georgia, we have the same thing, approximately 6%. In Ohio, the same thing, and if we go down, we'll see some states that have reduced with, that are reduced with 3%. And let's not forget that it also have to do with the population in this state. Our next visualization, the state Medicaid expansion 2016 by market tax credits. So the market tax credits is a kind of premium tax program that was provided to make marketplace insurance more affordable. So the ACA provided premium tax credit for individuals and families with incomes between 100% and 400% of the federal poverty level. Those with incomes below 138% of the federal poverty level could enroll in Medicaid in states that expanded coverage, while those earning more and could not afford to get or were not targeted for the Medicaid program, but does not have insurance and were not employed, or maybe they were self-employed, they could also receive tax credits to buy their marketplace plan. So this was a win-win for both sides. But this visualization is showing how it's affected states that adopted the program and for states that did not adopt the program. So we have some states, these first are those that did not adopt the program, and the other one is for the state that do not have that adopted the program. So the effect of this for state that did not have adopt the program is that in state that did not expand Medicaid, many low-income individuals are stuck without coverage as they fall into the gap between the Medicaid eligibility and qualification for tax credits. So they could not get the Medicaid help, and at the same time, they couldn't get, for those that were qualified for tax credits, could not get it due to the fact that their states did not adopt the program. So this is the average monthly tax credits by states. For the states that adopted it, the average monthly tax credit that they got back to be able to purchase a plan on the health insurance marketplace. And the final visualization shows the individuals or the population covered by health insurance and Medicaid plan by states. So from 2010 to 2015, in the total United States, we have health insurance coverage change from 19 million in 2010 to 2015. We have 57 million and above in 2016.